Hey everybody, Dr. Jones again, Active Health Chiropractic. Now this month we've talked a lot about back pain. We talked about some common causes why back pain happens. Talked about some conditions that have back pain associated with it. I also talked about some simple things that you can do to help yourself or help yourself get out of pain. Now I know what everybody's thinking. Everybody's on the edge of their seat and they're waiting for this last one because they all want to know, what can this guy do to help with pain? Well, you don't have to wait any longer because the time is now. So let's talk about that. What can I do to help with pain? Now, I'm a chiropractor. So I think the obvious answer, one of those things that I'm going to do is I'm going to use adjustments to help with pain. And really that's only if that person needs an adjustment. If they don't need to be adjusted, we're not going to adjust them. However, adjustments are a great tool to help with pain. We've been able to help tons of people that have been in pain for years and years and not been able to find relief. And it's a great tool to have to help, but if the patient needs it only. However, sometimes I have patients that don't want to be adjusted. And you know what? That's 100% okay. Not everybody has to get adjusted. Not everybody has to hear that popping sound. The popping sound isn't necessary for an adjustment to happen, but there's also some other tools that I have here in the office that can really help with pain. One of those is acupuncture. Acupuncture is an excellent way to help with pain. It's an excellent way to help manage it. And it's an excellent way to decrease those levels so you can get back to doing what you love. I've helped time and time again with people that have failed in other types of care, and even chiropractic care hasn't worked. Acupuncture has come in and been that tool that has been able to really knock down that pain so that they can get back to their life, even after years of pain. Dry needling. Dry needling is another great option for chronic pain. So just because you've had pain for a long time doesn't mean that you can't find relief. We have tons of things here that we can do to help. One of the other things that I have in the office that's a little more unique to my office, especially in this area, is class 4 laser therapy. So I have a class 4 laser, and some people are like, well, what does that do? Well, outside of parties, just kidding. But what the laser does do is it's really good about using light, focused light, to decrease inflammation, decrease pain levels, and help increase some blood flow. So we can really have a good effect on chronic pain, radiating pain, and anything like that. It's a great option for people as well, especially if they failed in other avenues of care. Laser therapy has been able to help a lot of people who think that there's basically no hope outside of surgery. However, if that's an option for you, I'll let you know. So the number one thing you can do really is come on in, get evaluated. We're going to look at you. We're going to figure out what's going on and why the pain is happening. And then after that, we're going to make sure we create a plan that's going to help you get better. So if you have any questions, call 417-781-9300 or visit acthealthchiro.com. And as always, have a great day.